Hi guys, in this video I'm going to be reacting to another episode of Grey's Anatomy. This is from season 2, it's episode 8 and it's called Let It Be. Enjoy!
From New York.
Weiss?
Derek, I've been looking for you.
Sal, what did you tell me you were coming? If I knew you were coming, I would have taken the day off.
Well, it was kind of last minute. Is everything okay? Are you all right?
A month ago, her mother died, ovarian cancer.
Catherine died? Sorry.
20 to 25% of all cases of ovarian cancer are due to a hereditary cancer syndrome. Most of the time it's due to mutations in either BRCA1 or BRCA2. So actually any woman who's diagnosed with ovarian cancer qualifies for genetic testing. And even just having a close relative with ovarian cancer is enough to warrant genetic testing for mutations that can predispose to ovarian cancer. And it's not just BRCA1 and 2, but there's several other genes that are related to a higher risk of ovarian cancer.
And Savvy, I mean, you know how close they were. I mean, all she could think about is this breast and ovarian cancer gene.
BRCA.
A positive test result isn't the end of the world, Sav. It just means you have a gene mutation that could...
I know what it is. I've talked to the genetic counselor, I've been to my gynecologist, and now I'm here.
Genetic counselors are healthcare providers who specialize in hereditary conditions, such as hereditary breast and ovarian cancer that's caused by mutations in BRCA1 and 2. So I'm really glad that she saw a genetic counselor and now she's seeking the opinion of a surgeon to talk about preventative surgeries.
Addie, you're the best surgeon there is.
True. But this isn't surgical.
Yes, it is.
No, Sav, you understand you don't have cancer.
And I have no intention of getting it.
So you want me...
I want you to take out my ovaries and the uterus. And when that's done, you're gonna find the best person out there to cut off my breasts.
So she doesn't have cancer, but she's definitely at higher risk to develop breast and ovarian cancer compared to the average woman. They didn't specify whether she has a mutation in BRCA1 or BRCA2. The risks do differ a little bit, but overall her risk of breast cancer may be as high as 90%, and her risk of ovarian cancer could be as high as 60%. Those are the highest risk figures I've seen. But really, if you look at the literature, you'll see a range of risks. So the range of risk for breast cancer can be somewhere between 40 to 90%. And for ovarian cancer, that range can be somewhere between 10 and 60%. So of course, it's very different to be talking about a 10% risk and a 60% risk, but it's hard to pinpoint exactly what a person's risk is. It depends on the population that they're from. They may have other risk factors, such as other genetic factors that can be protective or not protective. Certain environmental modifiers can modify their own risk. So it's really hard to give somebody an exact number, but we do know that her risk is high enough to warrant increased screening or potentially surgeries to reduce her risk. So the surgeries that she's talking about is prophylactic mastectomy, so preventatively removing the breast, and prophylactic bilateral salpingo oophorectomy, or preventatively removing both ovaries and fallopian tubes. Removing the ovaries is especially important because we don't have very good screening for that kind of cancer, and usually by the time a person has symptoms or a tumor shows up on imaging, the cancer is at an advanced stage with not a very good prognosis. So really it's very important for a woman to consider removing her ovaries, and our current guidelines say that for BRCA1 a woman should consider removing her ovaries sometime between the ages of 35 to 40, and for BRCA2 it might be reasonable to delay it a little bit between the ages of 40 to 45, since the cancers tend to happen at slightly older ages. And she mentioned removing her uterus as well as her ovaries. Uterine cancer is not really part of the typical spectrum of cancers that people are at risk for with the BRCA1 or 2 mutation, but There's some studies that show that there might be an increased risk of a particularly aggressive type of uterine cancer in people with a BRCA1 mutation. And so that could be one reason to consider hysterectomy at the time of the oophorectomy, so removing the uterus at the same time as the ovaries. There may be some other reasons to consider removing the uterus as well. So a woman who's considering removing her ovaries should talk with her doctor about the pros and cons of having a hysterectomy at the same time as the oophorectomy. So I do watch Grey's Anatomy, so I know from watching the show that Dr. Addison Montgomery is actually a maternal fetal medicine specialist. Those are doctors that specialize in treating women who have high-risk pregnancies. So really, this is not really the right surgeon for Savvy. I know that they're friends and maybe that's why she went to her, but ideally women with a BRCA1 or 2 mutation who are at high risk to develop ovarian cancer should be followed by gynecologic oncologists. There's a specific protocol that should be followed during a preventative oophorectomy to make sure that there is no ovarian cancer. And if there is ovarian cancer, the surgeon should be prepared to perform a full staging. So that's why somebody who's trained in this and has experience with preventative oophorectomy should really be the doctor who's performing the surgery.
My mother died of it. My aunt. My cousin, she's 37, has ovarian cancer.
But you don't. You don't have cancer. This is
But
crazy,
I have the
Savvy.
gene.
Which
Weiss.
gives her up to an 85% chance of getting cancer.
Well, we all have the gene. She has a mutation in either BRCA1 or 2. It's a pet peeve of mine when people say, I have the gene. Of course, we all have the genes. We all have 2 copies of BRCA1 and 2 copies of BRCA2. Their normal function in our body is to protect our bodies against developing cancer. So I sure hope we all have the genes, but sometimes people have a mutation in the genes. People always say, I have the BRCA gene. No, somebody can have a BRCA mutation.
In a 15% chance she won't.
I'm not betting my life on
invited?
15%.
Asked me to come.
I thought it might help.
Help? What? I'm sorry, Derek, because I love you and I'm really glad to see you, but until you grow a uterus and watch your mother die from this disease, you don't get a vote.
She tell you they're trying to get pregnant?
Yes, she did.
Having a hysterectomy is going to throw a wrench
Derek.
into that.
So they're trying to get pregnant, but it also sounds like she wants to have her ovaries out imminently. So I'm not sure if she's planning on getting pregnant first and then having the surgery. Actually, if she were to remove only the ovaries but still keep the uterus, she could technically be pregnant, carry a pregnancy. They would just have to get pregnant through assisted reproductive technology, so they should be referred to a fertility specialist for that. Another option would be for her to have eggs harvested and combined with his sperm in a lab to create embryos, and then those embryos can be implanted into a surrogate or a woman who carries the pregnancy for them, but it would be their biological child. Of course, there's other options like adoption, but yeah, thinking of having a child while thinking about these surgeries is kind of tricky.
We've been trying for months.
Why give up now?
Come on, we've talked about this. There are other ways to make a family, Weiss. We can adopt. We can
Savvy,
do it. No, I'm not talking about this.
Let's just take a step back. All right, take a deep breath. And think about this.
I've already thought about it, Derek. This is going to happen.
Dr. Stevens, get a complete history into her pre-op labs, get her scheduled for a double mastectomy, and consult Dr. Queenar at Plastics for reconstruction.
Derek.
Addison, this conversation is not
She is
over.
my patient, Derek.
Honestly, it's really shocking to see how unsupportive these doctors are. Savvy must be so frustrated trying to fight for these surgeries that are potentially life-saving. I mean, this unsupportive attitude could be a reflection of the times. The season was released in 2006, which was a time when a lot less women were opting in for these prophylactic surgeries compared to nowadays. And the surgeons and other doctors were a lot less supportive of preventative surgeries. Of course, that differs by medical specialty and by country, but definitely doctors were more unsupportive then than they are today. In fact, there's some early op-ed pieces that referred to preventative mastectomy as a desperate measure or a drastic option. So we've come a long way and acceptance is a lot higher now.
Is it the kid thing? I saw your face upstairs. It's the kid thing for most people. And the breast. Oh, and the total menopause, like overnight.
It's a big step. I think it's brave.
Thank you.
Thank you. It's nice that someone's giving her the encouragement that she probably needs to hear. I mean, the decisions that she's making are super hard, so it's nice that a doctor has finally acknowledged how brave she is.
They do excellent implants and reconstructions these days. Won't even know the difference. Plus, you'll never have to wear a bra again. That's something, right?
Alex? Didn't I see your service on the OR board for a biopsy right on now? It's not the kid thing.
Okay, what? It's not like I have a lot of options. 1, take my chances and never get cancer. 2, take my chances and die young.
There's a third option, you know.
Okay, I'm listening.
Take your chances, get cancer, and fight like hell to survive.
What? Oh my gosh, I can't believe that any doctor would essentially encourage her to take the risk of getting ovarian cancer. I mean, she has made up her mind that she wants to have the surgery. Wow, I think that's really inappropriate, especially coming from an intern. Wow.
We had a future. We had plans. We picked out baby names together. She betrayed that without even asking my opinion. Without even giving me time to process it.
It's a difficult time for both of you. She's emotional.
And hormone changes, mood swings. Say she could lose her sex drive.
You'll get through this. All right? You can do this. You guys love each other.
So there was a study published in 2016 in which the male partners of women with a BRCA 1 or 2 mutation were surveyed. It was a small study, only 25 men answered the survey, but it's interesting because a lot of the men who were surveyed had similar concerns as Savvy's husband. In addition to being concerned about her health and her life expectancy, a lot of the men who responded to that survey were also concerned about things like intimacy and physical attractiveness. What's interesting is that 11 of those men, their partners had already undergone preventative mastectomy at the time that they completed the survey, and all 11 men said that their level of attraction towards their partner didn't change. So that should be something reassuring for women to hear if they're concerned about that. Now, of the men whose partner had not undergone mastectomy, actually most of those men had never seen any actual pictures of what the reconstruction looks like. And a lot of the men seemed to think that it would be similar to cosmetic breast implants. So it would probably be helpful for women and their partners to see some pictures of actual reconstruction results and meet with a plastic surgeon to get a clear idea of what to expect.
Well, here's to taking life in your own hands.
Cheers. Cheers.
Yeah. And here's the bull and here's the crap. And here's the oophorectomy.
God.
Hysterectomy, double bilateral mastectomy.
Please, stop.
How smart am I to know all those words?
Stop.
Here's the breast reconstruction. Nipple reconstruction. Here's to losing your wife. Here's to being the ass who can't be supportive. Here's to that.
This is terrible. I mean, she's made decisions that are so hard to come to terms with, and she's brave for deciding to do this, trying to do whatever she can to reduce her risk of breast and ovarian cancer. So to begin with, it's a really hard thing to go through, but now on top of that, she has to deal with her husband not being supportive, and I'm sure if her husband was supportive, it would make it easier for her to deal with that and face those surgeries and all the healing that will come afterwards. But at the same time, I also feel bad for him. It sounds like she made the decision fairly quickly as soon as she got her test results. So he really hasn't had time to come to terms with it. Maybe if he had some time, he would get used to the idea. So it's just a hard situation for both of them.
Weiss,
Don't talk to me. Keep walking.
just get some sleep, sober up. So you're ready for Savvy's surgery. Come on, I'll drive you.
We're supposed to hold her hand while I rip her apart. That's the definition of love.
You can do this.
Maybe I can't. Maybe I'm just a guy who likes to screw his wife.
Weiss.
And that's what she'll think if I'm not there.
Now you're gonna be there.
Oh, I really hope he shows up. I mean, I think she'll probably go through with the surgeries anyways on her own, but how much easier would it be if he was there to support her?
I'm gonna take you down to the pre-op in just a few minutes. Weiss will show up, Addie. He always does. As your doctor, you know I'm 100% on your side, but as your friend, are you absolutely sure about this? I know what I'm losing. I get it. But think about what I'm gaining. My life. This gives me a shot. A shot at the future, a shot at me and Weiss. Becoming this crazy old, wrinkled couple that argues all the time.
Okay, it's really bothering me. This entire episode is just pretty much about these surgeons being unsupportive and her having to justify her decisions all the time. I mean, this is the last minute before she's about to go into surgery, and her surgeon slash friend is planting seeds of doubt in her mind. Seems that she had made up her mind from the time that she came to see her already. She had made up her mind from the time she saw her genetic counselor, it sounds like. So why are they still questioning her? I mean, she saw her mother die of ovarian cancer. She's trying to do what she can to reduce her risk of that cancer. I wish they would just all be supportive of her.
He's not coming, is he?
You shake?
You're here.
Yay, I'm so happy he showed up.
I'm gonna go ahead and get started now. You ready? Yeah. Ready.
Oh, that was such a nice ending. I wasn't sure if he was going to come around, but I'm really happy he showed up. And now she can go into the surgery peacefully and encouraged, so that's really nice. The BRCA1 and BRCA2 genes have been discovered almost 30 years ago now, and I'm surprised by how little they're portrayed in the media. So it's nice to see that a TV show covers this topic and how difficult it could be to make a decision about preventative surgeries. I think there's a couple of other shows that have depicted BRCA1 and 2 mutations, so I'll try to react to those. And if you have any other shows that you'd like me to react to, please let me know in the comments down below, and subscribe and hit the notification bell if you don't want to miss any more of my reaction videos or any of my other videos related to topics on hereditary cancer. Please give this video a thumbs up if you liked it, and I'll see you next time. Thanks for watching. Bye.